Hello everyone, this is Dr. Singh. I practice in Las Vegas, Nevada. Today we're going to dive into the topic of testosterone. We'll cover some of the side effects, how to give yourself testosterone, when it's too much testosterone, when it's too little. So a general summary of issues related to testosterone. So first of all, what is testosterone? So it's a male dominant hormone. It's secreted in men by adrenal glands and of course the testes. Women, it's secreted by adrenal glands and also the ovaries. Although men like to have a higher level of testosterone than women, but women also need a smaller amount of testosterone. Otherwise, they get symptoms of testosterone deficiency. So what are some of the symptoms? Of course, in men, we're feeling more tired, we get exhausted easily. We have what we call central obesity, so a lot of fat gets stored around the belly area. Osteoporosis rate goes up. Very low levels of testosterone, of course, are also linked with certain amount of cancers because testosterone is good for our immunity. So if your levels are low, you have an increased risk of certain amount of cancer. So we don't want too high testosterone, but we don't want it too low either. We want an optimal level for testosterone. Of course, in women, if the testosterone levels are low, they feel like they can't assert themselves. They can be overly emotional because estrogen becomes more dominant. They can tear up easy. So emotional problems are common. Lack of orgasm or difficulty maintaining orgasm, those are issues. So next is what's a bioidentical testosterone? So the pharmaceutical testosterone, it would be more of a synthetic version. A bioidentical testosterone would be that is more plant-based and that's more identical to our own testosterone. So it's mild, it has fewer side effects. Because if you look at it, if something is synthetic and it's very potent, when we inject it or we give it to ourselves, either way, it suppresses a lot of different hormones. Not just the testosterone, but it can suppress our own adrenal glands and the testes. So these glands, they make additional hormones in addition to testosterone. Plus you can have atrophy of the testes and the adrenal gland issues later years of life. So it's not recommended to be using excessive amounts or synthetic amounts of testosterone. Next is how to test. So blood tests are not reliable when it comes to testosterone or any hormone testing. However, blood tests are the most commonly done test because they're covered by insurance. Ideal way to test would be a saliva test for hormones because we want to know what's the free or the active form of the testosterone. It doesn't matter how much testosterone you have. We want to know how much is in the active form because that's what is going to exert its action. So if you have too much of testosterone in free form, which can happen if we are injecting very high doses, that free testosterone gets converted to what we call DHT or dihydrotestosterone. That can of course cause hair loss and of course can increase risk of prostate cancer. So we don't want the levels too high when it comes to free testosterone. So we test with saliva. That's the ideal way. Blood test is not reliable when it comes to testosterone issues or any other hormonal problems. Delivery methods. Injections are very common, of course. It can be used every 2 weeks, once a week, every month. They're the cheapest way to give testosterone and also the most way with the most amount of side effects. Why? Because it does not follow our natural rhythm of testosterone. Normally, for testosterone, my levels would be highest in the morning and then of course they're going to drop in the evening. If I'm giving testosterone, the levels tend to spike up. They stay high for the next 3-4 days. Men tend to be more hostile, they tend to be more angry after the injection. Then after that, after a couple of days, the levels as they start declining, they start feeling worse again. And then they get another injection. So it's just those spikes which does not follow our natural rhythm of testosterone. So of course, if you're injecting higher doses, you also have a higher amount of free testosterone, which causes a lot of side effects like I talked about, hair loss, and of course, prostate cancer. The other way would be to use a testosterone gel that can be rubbed on the skin. Of course, a testosterone cream that can be compounded by a compounding pharmacy. We also utilize pellets, which are like this rice grain type pellets that can be injected under the skin. Takes like 10 minutes. The benefit is the pellets can last up to 4 months and they provide you a sustained, very low levels of testosterone, just like our own body's production of a lower levels of testosterone. So that works really good. Of course, side effects. The side effects happen when we overdo on testosterone. If someone's levels are not low, they get a blood test done and the levels appear to be low, which is not reliable, like I suggested. And now they start injecting testosterone. A lot of bodybuilders, athletes, to increase performance, they're doing testosterone. So if you're doing testosterone and your body's already making testosterone, what happens is it suppresses your body's own production of testosterone. So now your glands are just sitting there. They have nothing to do because you are getting so much testosterone from outside. So that's a negative feedback. Now these glands are going to get smaller over time. So it's well documented to have testicular atrophy and adrenal gland issues if you overdo on the testosterone. So that's not something we want to do. We want an optimal level of testosterone that's age appropriate. We don't want it too low. We don't want it too high. An optimal level of testosterone is good for your bone health, for the sex drive. Of course, it's a good anti-aging hormone, and gonna balances estrogen out, so men have a fewer emotional issues. So very important to not overdo on the testosterone. There are oral versions of testosterone available on the internet. Oral testosterone is very toxic, should never be taken orally because it goes to the liver and causes liver damage. So not recommended. And I think that's pretty much my summary of testosterone. So we'll do a more detailed video hopefully in the upcoming weeks. If you have not done already, please either like this video if you enjoyed the content, and do not forget to subscribe. I will see you back in a couple of days with another topic. Thank you very much.